Hello everyone. Today's video is another Q&A video talking today about using MSM for methane SIBO, talking about headaches as a side effect of glutathione use, talking about high dose binders, and what else am I talking about here? And talking about the importance of doing heavy metal detoxes, or whether or not those are important to do or not. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. And if you don't mind taking a quick moment to, at some point, to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. So the first question here was posted on a video of a podcast interview I did with Dr. Kathleen Janelle about using high-dose sulfur therapy, also known as high-dose MSM, methylsulfonylmethane therapy, for treating a wide range of gastrointestinal issues. And so the question is, can that be used for treating methane SIBO? I guess the short answer is, in my experience, yes, it can be used for that purpose, in that I have patients with methane gas producing SIBO, and they have responded well to working with the high-dose sulfur therapy. Now, what I don't have to date is experience with folks with SIBO, where they test positive for SIBO. We treat them with high-dose MSM, then we retest them for SIBO, and then see that the SIBO has gone away, or has not gone away, or anything. Quite frankly, most of the patients that I've treated with high-dose sulfur to date have been patients who have already been around the block when it comes to being treated for SIBO, LIBO, yeast, H. pylori, exocrine pancreatic insufficiency, hypochlorhydria, parasites, low probiotic levels, etc. They've done lots and lots of different treatments, and MSM, in the majority of cases I've worked with, and I've worked with at least a couple hundred patients now with high-dose MSM, it's been more of like a last resort treatment. Most of the patients that I've recommended it for have been patients where I've been working with them already for a while. We'd hit a plateau, or in some cases really hadn't made much headway at all. Then we brought in the MSM, and that made all the difference for them. Of course, it doesn't fix every case. It's not a perfect therapy, but that's been most of my experience. Now, most of those patients, when they're finally feeling better, they're like, no, I don't want to go drop another, $120 Canadian to do a repeat SIBO test. I'm feeling better. I'm good. So yeah, not a lot of takers on the repeat testing, and I don't blame them, because they've usually already spent enough money up to that point. They don't need to spend another $120 to just see that, like, the SIBO's looking good. So I can't say that with in my experience, at least, with any certainty, that MSM, the high-dose MSM, can be used as an effective treatment to eradicate SIBO. But in terms of eradicating these symptoms in patients who are dealing with methane gas producing SIBO, I have seen that in several cases to date. Bunch of cases of hydrogen gas producing SIBO, and then a bunch of cases where they didn't have SIBO. There were other things going on, and then the MSM made a really big difference. So wonderful therapy for many patients, not everyone. It's not been a panacea, but I'm so thankful to Dr. Janelle for bringing that therapy to my attention with the course that she offered over a year ago now. I've been using this, and also for being on my podcast and just sharing this information with folks. So really awesome therapy. Can't say enough good things about it. So the next one, just a quick one. It says, is headache a common glutathione side effect? So I had a video where I talked about glutathione. This question was posted on that video. So I'd say that with glutathione, as long as it's titrated up, built up at a reasonable pace, bearing in mind the sensitivity level of the patient and what's going on with them. So if it's built up at a, not jumping into too high of a dose too quickly, I find it's generally well tolerated. But when patients do have side effects from glutathione, I would say that headache is a relatively common side effect that I see. Fatigue can be fairly common, brain fog can be fairly common, like an exacerbation of those symptoms, sometimes muscle aches or joint aches and pains, sometimes neurological symptoms. Headache can definitely be one of those symptoms that comes up. So relatively common side effect, but side effects not that common when dosed appropriately. The next one here is more of a statement than a question, but I think they ask in here what my thoughts are about it, and I just think it's a really interesting concept. So I'm just going to read this out. So it's a little bit lengthy, but can turn off the video if you don't want to hear me continue to talk about it. So it says, I have read anecdotal accounts from various people now that people can herx on small doses of binders with mold, but the herx disappears when they take large doses. I'm saying here 5 grams minimum, but often over 15 grams. I'm currently taking a binder mixture every 4 hours. Each dose is 5 grams of zeolite. Oh my goodness. Let's see, 5 grams of zeolite, 5 grams bentonite clay, 5 grams activated charcoal, 5 grams psyllium husk. I'm doing just fine with rapid improvements from mold despite having very severe MCAS, mast cell activation syndrome, and usually sensitive to detox reactions. The theory is that binders do not grip tightly to toxins, and to ensure you are not redistributing toxins, you require much larger doses. It's an interesting concept, and one I think the traditional mold experts have overlooked. I like the analogy of cleaning out a dirty drain pipe. We don't want to just trickle drops of water to clean it. We want a large and continuous flow of water to really get things moving. I can only speak for what's working for me. I would be wrong to assume this would be the same for everyone. This could be something for the next video to discuss. It could be pivotal with mold treatment. The idea that mold takes 6 to 12 months to treat makes it seem like there must be something we are missing, as I'm not aware of any other infection requiring such lengthy treatment. Yeah, so thanks so much for sharing that. And I'm not disputing, I think it's a really interesting idea, and I do have some thoughts about it. I will say, just for, clarification purposes from my experience, yes, it can take 6 to 12 months to treat mold in some cases, sometimes longer, sometimes shorter, but also like for Lyme, co-infections, chronic viral infections, more challenging cases of SIBO and LIBO, yeast overgrowth, especially when biofilms are afoot, 6 to 12 months is not unheard of. So I would, devil's advocate there, or semantics, whatever, would be like, well, I wouldn't. I would say mold's not unique in that. There's quite a few other subjects that can take that long, or issues that can take that long to resolve. However, it's a really interesting idea, and I was reading this thinking, oh, I'm really happy for you that you're seeing such good benefits with this, and it's very interesting, especially in someone who's identifying as being sensitive, or having prone to detox reactions. That the higher, the more is better, it seems, which is awesome. Also interesting, that there's this blend of different binders, because different binders have different affinities for different substances, and that's interesting. I guess my only clinical input would be that I've had some patients, and not many. I honestly haven't done this with that many patients, but I do have some patients where they've definitely done better being on, say they're on charcoal and their nasal spray, their glutathione, their other detox support nutrients, and they seem to be still reacting to, say, mold exposures that they're ongoing in their at their workplace, or maybe in their home, or they don't seem to be having a hard time tolerating their nasal spray or something like that. And so I'll put them on a second binder. So they're on their charcoal, and then I'll put them on bentonite clay as well. Or they're on their bentonite clay, and I'll put them on modified citrus pectin as well. And I've had some patients where they do better being on multiple binders at once. And, we'd probably be, well, yeah, I don't know, 5 grams of 5 grams of activated charcoal. That's a pretty hefty dose in my experience. So that's quite a bit. I probably use usually around a third of that, give or take, I would say, ballpark. Sometimes higher, but usually that much. So it's a really interesting concept. And honestly, when I recommend binders to my patients, and if they start to flare, then I'll usually just back off on that binder and move to something else. It's an interesting idea to go even higher dose. And I'm very aware of the fact that binders don't have a perfect binding affinity that we'd like them to have. So it does make sense that more might be better. But yeah, it's very, very interesting. So it's got my gears turning here, and that's an interesting idea. So thank you for sharing. And I'm not sure what to say beyond that, but yeah, some patients on multiple binders, in my experience, have done better, but I've never dosed them that high before. So that's very interesting. Let me see here if I have time for the last one. I do not. Okay, so I will not talk today about the importance of doing heavy metal detoxes in general, or whether they're important or not, but I will talk about that in the next video. So we'll leave it there for now. I hope this is all of interest, and any questions on these topics or anything else, just post in the comment section below, and I will do my best to answer as soon as I can.